So this is how the future hospital might sound, undulating with movement and life. Physicians being guided by their environment, not distracted by it, and patients being able to heal safely. The alarms and bells that characterize hospitals today could dissipate completely. Good afternoon. My name is Elio Icaza, and as mentioned by Andrew, I studied industrial design at the Rhode Island School of Design. And my own work focuses on the intersection between design, technology, health, and education. And for my thesis project at RISD, I wanted to create an assessment of the soundscape of Rhode Island Hospital in the United States. So, assessments like these have been used by Rhode Island Hospital in order to understand interventions they can take into their own soundscape. So soundscape is the aural environment, the sonic environment that you exist in. And as a designer, I look at systems like these and try to understand how they affect the experiences of people working within them. So I wanted to understand the soundscape, again, from a physician's perspective. How does this affect how they work? How does this affect their lives? And so I needed to understand what sounds exist in this environment. How are they negatively or positively affecting somebody? Where are they? And how perceptible are they? When can you hear them in different parts of this space? So I did, as you can see here, this is some of the analysis from my own project, which is now being used by Rhode Island. And we also created different typologies. What are the different areas that one could experience sound in within the hospital? And also, to be more specific, this is the emergency department. So this is where people are wheeled in, they're just hurt, they're bleeding, whatever. They're wheeled in here and they're taken care of. And it is one of the noisiest, loudest parts of the whole place. And so in order to understand it, we worked with a couple physicians and asked them to record an 8-hour day of theirs, with a microphone and geolocation. So we wanted to know, where were these physicians? What sounds did they hear? And I'd like to show that video to you right now. So this is beginning of the day, then there's the middle of the day, and then there's nighttime.
It's really important that you do not go onto your side. Stay on.
You just say, oh, by the way, guys, I just drank a bottle of liquid cheese. And then it was like,
Okay. That's fine. I hang up.
So you can start to note differences between different periods of the day, different rooms that the doctors are in.
Are you coughing anything up at all?
no, very little.
Are you having any pain anywhere?
Okay, the attending's down here now. Yeah.
I think he's the intern.
Or Suda or Suka, is it?
I think he's the intern.
No, it's one of the thoracic surgeons.
I think he's the intern. I don't think he's attending.
No, he wasn't attending.
No, he said he was an intern. I think that's what he said.
Who's the doc? No, he wasn't attending. Who was that? Suka? Suda? So, Dr. Soda?
I think he's the intern.
Yeah. Yeah, do you
so.
guys need to know?
Scary sounding. Oh, hi
how do you feel?
I'm
Okay. Yeah? Good.
So in our data, we discovered that there's a correlation between a physician's movement in the space, the placement of sound sources, and the architecture of the space that affect how a physician perceives their sonic environment. And our data also showed a correlation between the amount of alarms and doctors' voices. It turns out human voices were louder than alarms, even though alarms were more common. So it's kind of a difficult challenge to create a solution for. Are physicians speaking louder because they're trying to overcome all these alarms? So there's a hospital in Boston that managed to tackle this problem by changing the alarms, and they just lowered the threshold of when an alarm sounds. So the beeps that you hear would only happen if a patient's condition was seriously different than it really was. It wouldn't be constantly sounding. And they got rid of 89% of unnecessary sounds. The amount of unique noises went down from like 87,000 to 9,000. It's pretty impressive. So I hope my presentation and what I've shown you today starts to give you an idea of what healing may sound like, how to assess the own soundscapes that all you work in or live in, and also to compose those ideas into experiences that are empowering for people. That's really important because sounds can both empower and also take away from one's experience. I'd like to end with a composition, if I have enough time. And this is taken from the triage, right where patients come into the hospital. Before I end, I'd like to thank Andrew, Jeff, and Michaela for the support of my work. I really want to say thanks to Doctors Kobayashi and Zhang, who worked with me on this, and Marcus Berger, who's an architect. I'd also like to thank the doctors that put time into recording this and putting their work time into this. And I'd like to thank Genevieve Marsh, my fellow RISD collaborator, and my love, who was integral in the analysis and presentation of this work. So, thank you.